สวัสดีค่ะ Good afternoon. Welcome back to our Health Talk, Health Dialogue by BDMS. And I'm Ying Nanhawan. We are back again. Today, we are here again with Dr. Kaptan Wiriyaluppa. He is the eye surgeon from Brightview Center, Bangkok Hospital, Phuket. สวัสดีค่ะ So we met before actually, but there are many diseases about the eyes, and this is I have to say this is a very important organs. And today we are going to talk about how we can blow the floaters away. And I would like to ask our doctor, Dr. Kaptan. So what is it? What is the floater? Because sometimes many people complain that they have seen something like black cloudy or bubble and block their visions. Can you explain to us?
Okay, the floaters, we mean when we talk about the floaters, we mean that something that move with the eye. Some people see like a black spot. Some people see like a rings, like a cloudiness that move with the eye. It's not fixed in. It's not fixed in the vision.
It's like something floating in the water or jelly
Yes,
things.
correct. It's like something floating in the water. It may come and it may go. And then that was we call floaters.
And it can be many different shape, different form, right?
Yes, correct. Some people, some patient came to see me and describe like they see like a mosquito or something like that. Okay, it can the floaters can come in many forms. It can come with the black spot. It can come with the cobweb, and it come with something like a line. Or some people see like a rings that in the middle or floating around in your vision.
So I mean, you will listen to them and you will check. I think this is because of we are using the eyes in different way. Why they are different, or it's because of our aging.
The floaters each patient see floater in many different forms. It depends on their perception and it depends on which kind of floater that's happened inside the eye. Okay, I may show you the simulation that patient see the floaters. Can we go to the slide number 4, please?
Is it sometimes happen like they say that it's like spider web, but you see something different?
Yes, correct. Okay, we are at slide number 4. Okay. Okay, scam. Yeah, and that's the floaters.
Like.
Okay, when you some patient are driving and they see like this thing that's moving around all the time.
Maybe they try to clean their how to call their car and they blame that the car is dirty, but actually it's because of the eyes.
Okay. Some people say it in many different forms. Can we go back to the slide number 3? Okay, I will give you some more example that what people see. Slide number 3, backward, please. Yeah, this one, yeah, you can see like a black spot, you see like a cobweb, or you see it's like a line, or it's like a ring. But the important thing is it's moved, it's not fixed in the vision.
Okay. So I think if it's not too much, maybe we can look through and we can still drive a car, and if it's not dangerous. But I think if it's that much, like the first picture, the second picture, I think I cannot continue driving with that eyes.
Okay, I think most people they see floaters already, but only some people that have problem with them because sometimes the floater is just in the middle, in between your eyes and the thing that you want to see, and that's become a problem.
Yes, driving can be very dangerous. So, but are they dangerous, these floaters?
The floater. Okay, I will explain first of what causes the floaters. Okay, because it's a little bit complicated. So we will go to the slide number 5, please.
With the eyeball.
Okay, so I can show you correctly.
And you said that it's because of aging also.
Okay, this is this picture will explain you where the floaters happen. Let's see that you see the floaters in front of your eye, right? But the floater is not in front of the eye; it's inside the eye. In fact, the floater is happen in the very deep of the eye.
Okay.
Okay. As our discussion
with the other symptom before.
In first previous episode, I usually explain you that the eye we have two different parts. The front part is where you can see yourself in the mirror. That's called the front part. Okay, and the back part is in the very back. It's in the socket.
The eyeball,
it's in the very deep of the eye. In the back part of the eye, we have two organs. The first one is we call the retina, which is like a wallpaper lining in the back of the eye, and that sends the signal from what you see to your brain. Okay, that's the retina. And in the back of the eye is filled with the gel. Okay, when people getting older. When you're getting older.
When I'm getting older, everyone will get old.
Okay. After the age of 40s, the gel inside the eye will become changed. We call it is degenerate. This is part of the normal aging process. And when the gels become degenerate, it will separate itself into the thicker gel and the water. The thicker gel sometimes it become more cloudy. And that become the floaters because you see the cloudy gel that move. And it is because the gel itself become cloudy when you move the eye, gel move. So that's why floater happen and why it's move, because it's in the gel in the back of the eye. When you move your eye, it move, it come and it's gone. So and that's how the floaters happen.
I'm thinking I have to check my head and then I check my eyeball, maybe it's help. Okay, so that is how it's happened by degeneration or because of the age. So it's hard to stop getting older. But if we have that kind of floater, are they dangerous when we have it? Can we live with it, or how should we manage?
Okay. In fact, there are two different kinds of floaters. The first kind, I will call it the serious floater. The serious floater is this kind of floater is usually happens suddenly. If you not see the floater before and the next day you see it and you see it a lot, that may become a problem. And especially when you see floater combined with the flashing sensation like a lightning that happen when you move the eye. And that may indicate that it have the problem.
It's really then dangerous, especially when we have to drive.
The floater in this case, why we call the serious floater, the floater itself is not a problem, but what is a problem, because this kind of floater may be the early sign, warning sign of the problem in the retina, which is in the eye nerve. So that's why I call it. Sometimes it's in fact this kind of floater. Sometimes in fact it's the blood in the back of the eye, and patient see it as a floater.
So if you see and you think it's a floater and you decide to live with it, better come and check first to confirm that it's just a floater or retina problem.
So that means that if you see new floater, new floater combined with new flashing, you have to check to make sure that it is not serious.
So it's not difficult. Just come to Bangkok Hospital Phuket. But please make reservation 1719 and ask for Brightview Center.
And the second part, the second kind of the floater is not dangerous. Mostly this kind of floater is happened long time already with you. It's not getting worse. It stay there. It may cause or not cause problem, and this is not a serious floater.
But I think maybe it's also how to deal with it. It may make me, for example, if I have floater, even it's not a dangerous type, but it's annoying. But if the procedure to like how to take care of it, then I may make decision to come and remove it.
Okay, before we going to that, I will show you exactly what real floaters look like when we have the examination in real patient. So I will show you on the slide number 6. This is when patient came to see me and we have the examination. What you see in the picture is when I have the examination in the very back of the eye, and I project the light from the instrument into the patient eye, so you can see the cloudiness. This floater that you see in the screen is the ring shape. Okay, so this patient came to see me because they have a problem that let's see like ring, ring cloudiness, cloudy ring that moving in front of their eyes all the time. Okay, so this is the one kind of floaters.
Yeah. So when you check and then you will see. That means if you start going to do something, you have to see the floater too.
Yes, correct. I will have the examination and we'll see the floater too. Okay. And the next one is the real examination. I will show you the video. It is another kind of the floater, which is very cloudiness in this patient. So we go to the next slide, which is the number 7.
Yeah, this one.
So you can see that this yeah, you can see that this is patient eye, right? And I project the light into the patient eye, and you can see the cloudiness. Yeah. Like a spider web. Yeah, right? This patient have a lot of the floaters. Okay, so he came to see me because he said that there is some cloudiness that in front of his eye all the time. Okay, because this is a lot of floaters, and it's happened many years already. As I told you, there are 2 different kinds of floater, right? This kind of floater is not dangerous because patient told me that this one is happened long time already, and
I mean, but now feel like it's more or too much.
Something like that.
It's annoyed too much, and he has to do something.
Yeah. Correct. It make his life more difficult. So he have a consultation and asked me that what we can do with it.
I think that's a good idea. If we are in trouble or we have the problem, we don't make our own decision, but we have the check done, and then we get the suggestion from the expert. Because I really worry because I only have 2 eyes and I have to live with it. I don't know how long, but I need it. I need them.
Okay. And next, I will answer you when the floater happen finally.
How to get rid? How to blow it away?
Okay. When you if you already have the floaters, you have 3 options available for you.
Okay, 3 options.
3 options. The first one, you can live with it.
Okay.
Okay, because the floaters, this type is not dangerous.
Maybe each patient also different.
Correct.
Some may like if you talk about pain score, some may say, oh, it's okay, it's still okay. But some may think, no, even that small, I want to remove it.
Correct. Okay. Let's say if you feel fine with the floater, if it's not cause any problem in your life, because this is not dangerous, and you have the check you have the check examination to make sure the retina is okay already, you can choose to live with it because it's not dangerous. If it's not cause you much a problem,
I think also depend on each person activity.
Correct. So you can live with it. And the second one is you can have a surgery.
Surgery on the eyes?
Yes, correct. Let's say this option is we rarely do it. Because if we like to remove the floater, as I told you already, that the floater sits in the very back of the eye. If someone like to remove it by the surgery, we need to have the drill.
You said in the back, so you have to go to the back.
Correct. We need to use the instrument like a needle that it's like stick it into the eye and go into the back of the eye and remove the floaters.
Is it the only way?
Let's say long time ago, this is the only way.
Oh, okay. Long time ago. It sound like you have something new.
No. Yeah, the surgery itself is, I would say this kind of surgery is risky.
Of course.
And because of the floater, it's not dangerous. So normally we rarely do it.
Okay, because it's not worth some time to do invasive. Yes.
Okay, the simpler word, the risk is outweigh the benefit, so we not do it. So normally, long time ago, when the patient came to see doctor with the floater problem, they will be told to live with it. Okay, not touch it. It's just like that because it's not dangerous. Okay. And the option number 3, which is what we will talk about today.
I make a witch.
The option number 3 for the treatment is not dangerous. This treatment is less risky, and this is kind of new treatment. Not
dangerous, not risky.
Yeah, we can remove the floaters with the laser.
Okay, sounds comfortable.
When we okay, I will show you the slide number 8.
Yes.
This is how we remove the floaters. We will just when we do the laser on the floaters.
Okay.
In fact, we will use the laser to focus the floater, which is the floater that as I told you is the gels become more cloudy, right? So we just aim the laser into the cloudy.
You have to focus, aim it, and
shoot it.
Shoot it.
We will shoot the floaters,
Okay.
and what the laser do is the laser will vaporize the floaters.
So make it like smaller and
it will disintegrate the floaters, and it will vaporize the floater into turn into the small air bubble inside the eye.
From the web turn into air bubble and also gone within kind of how long will it leave, or the bubble will go away?
Let's say when the floater have been disintegrated into the air bubble, it takes about 1 to 2 days for the air bubble is gone.
That's it.
Correct.
It sounds very easy. Wow.
This treatment is let's say is have been developing lately because we use the laser for the eye treatment for a really long time already, but the machine itself that allow us to do this to treat the floater have been developed lately, have been let's say they make the machine is more precise, better, so we can do this.
So that
safely.
is the machine that now only deal with the floater?
Yes, something like that.
Yes.
So that means this kind of the laser is very precise. The point is when we have treatment on the floaters, we will not risk the other organ inside the eye.
Okay.
Let's say where the floaters, where the laser is aimed, and its focus is in the middle of the gel, which is no organ.
Okay.
Besides that,
free form floating. Okay.
So that's why this kind of the treatment is very safe, because it's not focused in your organ, it's focused just in the gel, which is no organ.
Like you're shooting into the gel.
Correct.
Okay. I will call it like floater killer machine.
Okay.
So I mean, if you said my age, like 50 plus years old, and normally when it's happened, both eyes are the same, having the same problem, or is different?
It can be both eye, but usually it's just one eye.
Oh.
Mostly patient will have more symptoms, floater problem, one eye than the other. But there are some that have two eye problem.
I understand. I think I can understand that. Even the eyesight sometimes like short and like longer, it's also different number. Okay. Fair enough. So that means I don't have to do both eyes at the same time. Okay. How long does it take for your technique and how to kill or to shoot the floater? How long does it take normally?
When we have this kind of treatment, the floater laser treatment, you will not need to stay in the hospital.
It's outpatient service.
Yeah.
I mean, can be done during the daytime. So I make an appointment, I come to see you, and it can be done.
First, you come, for the example, if you come to see me with the symptoms, I will check your eye first. Okay. And make sure that this floater is safe for the treatment. Okay. If there are some risk, maybe we will not do it, leave it like that, because it's not danger. Okay. But if your floater is safe to be treated.
Okay. Safe to be treated.
You will. I will schedule you for the laser, because it will take you about 20 minutes at least. Well, it takes time about 20 to 30 minutes per session.
Okay. I have to say, once when our doctor say 20 minutes, it doesn't mean that we do it longer because we don't do what doctor said, but actually preparation. He will spend time with your eyes, kind of 20 minutes that he said, but preparation when you step into the hospital, there are any other things that you have to do, like once when you step in, of course right now we do the BP, blood pressure, body temperature check, and also we need to check your blood pressure, and also like cleaning preparation. So So give us longer than 20 minutes, please. Do not expect that when you come in 20 minutes, I see Dr. Captain and I will say goodbye. Just take longer than that.
With 20 minutes, this means when you just sit with me and I shoot the laser for you, that takes 20 to 30 minutes. Okay.
But before and after, please be
yeah, there will be before and
understand.
after also. And then when you having the laser, I will tell you what it just look like.
Okay.
I will when you will be sit in the machine, which is exactly like the examination machine. Okay, I will show you this slide.
This is me. I want to understand him the best, so I've been there and he showed me how.
So you will sit in the machine just like this, and I will touch your eye with the special lens. Just touch. But I will put an eye drop to numb your eye first before touching into your eye.
Okay, so when numb, then I'm not very sensitive. Yeah, okay.
Yes, correct.
I don't feel much.
And then when we shoot the laser, right? The laser will just have the treatment effect just where it's focused.
Okay.
So that means there is no wound in the eye.
Okay.
Normally, when you have this treatment, there will be no pain, but you will hear you will hear the sound from the machine.
Like machine.
Yeah, like a gun shooting, something like that. And when you have the treatment, yeah, there is no pain, and normally you will not see things much during the treatment. And that's what happened during 20 to 30 minutes.
Okay. So this machine is now located at your station at Brightview Center, 2nd floor, Bangkok Hospital, Phuket. Yeah, but I mean, after the check is done, and also he can perform this treatment to blow or to shoot your floater away. After that, how long does it take? I mean, to see things. Can I go back to my normal activity, daily life, or how long I have to rest myself somewhere?
Let's say after the procedure finish, there is no you will not need there is no need for any special care,
because you said no wound.
Because there is no wound, there is no incision, so there is no special care. You will be given within an eye drop for a few days. That's it. That means after patient have this kind of laser, they can go back home, continue their daily life. They can play sport, swimming, do things.
Swimming.
No problem.
That's what I'm going to ask, because people who are living on this island, they love swimming. Not everyone, but most of you love swimming. Some activity or some treatment that after finish, they always ask me, can I go to swim? Can I go to swim afterward? And let me ask you, it sounds not dangerous at all. And it sounds like it's kind of simple treatment nowadays. But how many % that you have the statistic, I hope, that how many % that they achieve and they are happy with the result?
Let's say, I would say that the real result is pretty good. About, I would say about 90%. Yeah, the patient told me that the floater is significantly better.
Okay. 90% said better. Yes.
Yeah, and in this 90%, half of them, the floater is completely goes away. There's no floater left.
So, can I ask you, are they coming back sometime?
No.
I mean the new version of floater.
No.
If I have this floater before, it will not happen again with me.
Let's say the process that make the floater happen is the degeneration in the eye, right? Mostly these kind of the changes or the degeneration is happen for some time.
Yeah.
But when the process is finished, I mean when the degeneration is finished, it's stable.
It's stable. Oh, that means at least the eyes are younger. Besides that, we have to fix it later.
That means when so that's explained because when the degeneration process is finished and the floater stay there, it's no. So that's why the patient came to see me in the first place, and they told me that they have this kind of floaters for many years, because the degeneration in the gel is finished already, but the floater is there.
I see. Okay. But if I live up to 100 years, maybe it's come back after 50 years. Okay, that sounds very good. So that can be just come to check, and if it's annoying your lifestyle, you're doing some activity and these floaters block your view, please come and check. Since Dr. Kaptan already said it can be retina problem. If you think it's a floater, maybe you don't come to see the doctor because you think that you can live with it, but make sure that it's floater, okay, or it's retina problem, right?
Yes,
Okay.
correct. Oh, one more thing that I forgot to tell you that this when you have the treatment, normally patient will need at least two session. I mean, for the laser.
Okay. So you will not clean and clear everything within one time.
Not one time.
Okay.
Some patient, yes, we can finish it in
That
just
means
one time, but
depend on
mostly it will be two.
how many or how much.
Correct. Yeah, if there are a lot of floater, it will take a lot of session to do it.
Okay. Or it can be more than 2 times?
It can be.
Okay.
Between the session, it will take you about 4 to 6 weeks apart.
So no problem for the expat who are living on this island, but maybe problem for the tourists who come and stay only short period of time. But anyway, I think if something happened with our eyes, we should focus and we should check, because other part of or other organs of the body we still can use, or we still some part even we can have something new. Artificial one, but the eyes are very important. Okay.
And I think before we finish this one,
I need them to see the video.
I will show you the video.
Because it's really clear video. I have checked before and it's interesting to see. Okay, we can play the video for our expat friend. Yes, and you will see how's the things. Where is it?
This may indicate the presence of floaters, small specks of tissue within the vitreous, the gel-like material that fills your eye. Floaters can cast shadows on the back of your eye, causing tiny specks to drift across your vision.
That's the white thing, that is the floater, right?
Floaters can become more common as the vitreous shrinks over time.
Like a cloudy gel just floating in the back of the eye.
Floaters are not only bothersome, they can also interfere with your vision.
It's really kind of interfering.
If floaters affect your daily life, consider laser vitreolysis.
Many people who rub their glasses all the time.
This quick procedure uses a light to break up and vaporize floaters. The procedure can be performed in a doctor's office and takes only minutes.
Laser vitreolysis.
Before the procedure, your doctor will prepare your eye by applying eye drops and a contact lens. Then, using a special microscope, the doctor will identify the bothersome floaters and apply the laser. The laser turns floaters into small gas bubbles that dissolve and reabsorb into the vitreous.
Focus only, so that's why there is no wound. It's not like a
During and after the treatment, you may see some dark specks and shadows.
I think I should see you every year.
But don't worry, those go away soon after.
45, but now
You can go home shortly
only once a
after
year
the
is
treatment.
enough, right? To do the eye check.
for your age.
Okay.
Over the following weeks, you can expect improved
And it's not
vision.
just like normal
Based on your
vision,
results,
we are
multiple
over-
sessions may be
over
required.
45, over 50 years old.
Depending on your
We have
health
to
history and
focus
type
on
of
many
floaters you
different
have,
organs.
you may be a candidate for laser
That word
vitreolysis.
sounds scary. Degeneration.
Talk to us today to learn whether laser vitreolysis can offer you relief from floaters.
Sir,
Okay, I think we will post with this video in the link. So if you like to have more information, you can see this video in the link.
okay. I
It will be
think
useful.
if you are the fan club or FC of Dr. Kaptan, we have many episodes that that I discussed with him, and it's really interesting. And you always can go back and check the information. You can also be our friends on Expats Link. Please add us as your friends, and if you have any question, please send us your question. And even for example, if you want to listen to the other expert and which topic is interesting for you, which area that you forgot, please send us your request and I will find the expert who will come and talk to you. Today we are here with Dr. Kaptan, and I think we clear our floater, and we clear a lot of questions in our mind. So I have to say thank you once again, and I will invite you again, of course, for the next episode. And for today, thank you for joining us. And next time, we're going to be back on live at Bangkok Hospital Phuket Facebook on 29th, the last Thursday. So stay tuned and we will see you again. Thank you for your time. Thank you for joining us. ขอบคุณค่ะ Stay healthy. Bye bye.